Happy New Year, everybody. This is Dr. Abayomi Ajayi live, and my name is Dr. Abayomi Ajayi. It's a beautiful evening in Lagos, and this today is the first program for the year 2019. I'd like to start by wishing all of you success in everything you do in 2019, including your fertility journey. Today's program, being the first for the year, we're looking at New Year's resolutions, or the resolutions you need to make if you are trying to conceive. What decisions do you need to make if you are TTC? Of course, the word resolution is a noun form of the word resolve. It's a promise people make to themselves to do something or behave in a certain manner. For you to do that, that means you need a lot of determination to stick to your plan for the year. And even for your fertility, also if you are TTC, for you to be able to stick to your plan, you need a lot of determination. And so that's one of the things we need to know, that a lot of, it's not a tea party, it's not a picnic. There are going to be ups and downs, but not to worry, you'll be successful at the end of the year. What is important is that by the end of December 2019, you should be able to carry your own baby or babies. You know, we believe here that every woman who wants to have a baby should be able to have one. So, if you are TTC, the first thing you need to do in 2019 is you need to go for proper evaluation. You know, in a country like ours, sometimes you see people who are going through the challenge of infertility, and the only investigation they've done is just a scan. And you see, they say, oh, the doctor did a scan and nothing is wrong with me. Come on, that's not enough. The first thing you need to do is proper evaluation. What do I mean by proper evaluation? A seminal fluid analysis, that's testing the sperm test must be part of it. Actually, it should be the number one test that should be done. Okay? Why is it number one? Because we know that about 50% of the causes of infertility are from the men. And therefore, and of course, it's the easiest test to do. So, this seminal fluid analysis must be done. You must do blood work to see whether you are ovulating, but most importantly, to see what we call ovarian assay. That is the stock of the eggs that you have at that present time. You know, everything is about the raw materials that we're going to use. That's why we're talking about testing for sperm, and then also to see the quality and the quantity of the eggs that you have at that point in time, because that's what we can work with. So, then also, one of the tests that must be done it's a scan. In this environment, fibroids are very common. We all know that. So many figures have been given, but up to about 30 to 50% of our women, we have fibroids. But we know that it's not every fibroid that we need to remove. So if there are fibroids, if anything is a cyst in the ovary, these are things that we need to find out before we can do anything. It's part of the assessment for the fertility. And recently there is something called follicle count. That is, we can see the number of follicles that are not matured yet, because it's from the immature follicles that the body is going to recruit. So we can count the number of follicles when they are not matured. That will give us a kind of idea of what your stock is. And then again, because we know that tuber blockage is the commonest reason for women to have infertility in this environment. So it's important that you must have done a test to look at the tubes. So you can imagine somebody who has just done a scan test. You have not tested for your tubes, you have not tested for the seminal fluid. So it's like you have not done any test at all. So it's important that these 4 tests must be done before we can know what the cause of the infertility is. And you know what? In this environment, if you have done these 4 tests, you will have been able to find out the reason for 85% of the infertility in this environment. So it's something that is very important. Evaluation must be done, and must be thorough evaluation. Now, please like and share this video on your timeline so that other people can also see, especially those who are not here right now. Well, also, if you have not received your gifts, please send me an inbox message so that I can make sure that you get it. Okay, I know we have some people who are living abroad. There is a challenge to them. You can donate it, and we'll send it to whoever you want us to send it to. So, after the evaluation, one thing again you must not forget, which everybody who is TTC must always bear in mind, is the issue of the biological clock. Mrs. Obama spoke about the biological clock sometimes late last year. There is no doubt what the current knowledge is that women are born with the number of eggs they're going to use in their lifetime. Okay. We also know that there's some conditions, some pre-existing conditions that might affect your egg store. For example, if you have polycystic ovarian disease, it's good that you get treatment for it. If you have endometriosis, it's good that you see your doctor. If you have diabetes, this also can affect your fertility, so it's important that it's attended to. But back to the ovarian stock and age. If you are less than 35, well, that's when the definition of infertility that you can wait for 1 year holds. If you are more than 35, please, 6 months is enough for you to have a proper evaluation. Now, the problem really is for people who are TTC and are over 40. Okay, this is like an urgent matter. They need to do something like now. Because for those group of people, despite the fact that the chance that they can conceive, either spontaneously or through IVF, is reduced, I'm not saying it is zero, because people sometimes quote this out of context. What we say is that your success rate is less than 10%, okay? About 10%. But the problem really is not that you cannot even just get pregnant. The fact again is that the chances that you have a miscarriage is higher than the chances that you have a live birth. So it's like burning the candle at both ends. It's difficult to get pregnant, and it's easier to lose the pregnancy. So this is a very important age group. If you are over 40 and you are TTC, please, you must do something like now. If you have been taking a rain check on your fertility, this is the time to bring it to the front burner. You know, because like we said, the biological clock is ticking. I'm not trying to frighten anybody. You know what? We're trying to see how we can guide ourselves for the new year, so that we can, by the end of the year, we can all be carrying our baby or babies. Now, one other thing which especially you have control of is your lifestyle. And this is something that you need to take control of this year. You must maintain a healthy BMI, the body mass index. It's important because the Association for the American Society for Reproductive Medicine says that about 12% of infertility is due to weight problems. So it's important that you must maintain a healthy weight, especially after this festive period that we have all gained a few kgs. It's important that we go back to what we were doing before. Moderate exercise, increase your water intake. And one thing that is coming up very strongly now is the fact that we are what we eat. So your diet is so important. There was a study from Harvard University which reported about 18,000 nurses trying to get pregnant. It was called the Nurses Health Study, and it was published in the American Journal of ORG in May 2018. And they were able to see that your diet affects fertility. They also were able to cut down to some items that might help women who are trying to conceive. And with some of the things that were identified was salmon, that it can help women who are trying to conceive, nuts, seeds, beans, spinach. These are things that people who are trying to conceive should, especially women, should eat more of. Of course, don't forget that we've spoke first about your assessment, your evaluation, because, for example, if sperm count is very low, that's probably not going to do anything much. For men, dark chocolate, berries, citrus fruits, chicken, fish were found to be helpful for men who are TTC. Well, for the two of them, whole grain was found to be beneficial for both men and women. Things to avoid are essentially trans fatty acids found in processed food. That was shown to be harmful. Dairy, alcohol, caffeine, and soybeans were found to be neutral in effect. But that's one study. But in that same study, they also said that for those doing IVF, soya milk, soya generally, and folic acid may have a positive impact. So if you are doing IVF, there's some of those things that you need to add to your diet. And then I mentioned some of those things that you need to avoid. If you are just even TTC, those are the things that you must include in your diet, especially when, for example, there's been no cause found and pregnancy is just not happening. These are things that might promote or help your fertility. Of course, we know that cigarette smoking is a no-no. You know, we know that both whether those who are smoking actively or even those who are smoking passively, when your partner is smoking, you are smoking. You know, although it's passive smoking. But we know that smoking makes eggs to deteriorate faster, and smokers come to menopause about 4 years faster than people who don't smoke. So the incidence of early miscarriages increases in smokers. The incidence of ectopic pregnancy is increased in smokers. The good thing about this is that all these changes that smoking causes, they are reversed in within 1 year when you stop smoking. So if you are TTC, please, you need to stop smoking. Like I said, it's not only the woman, but also the man, because when the man is smoking and is in the same confinement with the woman, it's as good as the woman also smoking. Now, if you are doing IVF, smoking reduces the chances of success drastically. So, the fact that you want to do IVF does not mean that, okay, some people believe that if you are doing IVF now, it's just this thing that opens every door, so you can continue doing what you were doing before. No. Smoking reduces your chance even when you're doing IVF. With alcohol and coffee, well, the rule is moderation. If you can stop, but moderation is good. For coffee, not more than 2 to 3 cups of coffee a day if you are TTC. And of course, you must reduce stress. That's usually a big problem because people ask me, how do you want me to reduce stress? Are you saying I shouldn't go to work? We know Lagos is stressful. Yeah, but You must distress, you know. And now there's so many things available. There are mind-body programs that can help you to distress. There are yoga classes even in Lagos. There is acupuncture. Those are some of the things that can help you to distress. And then, of course, one other thing that you need to pay attention to are support groups. One of the things that infertility does to you is that it makes you to feel as if you are facing the world alone. When you come into the midst of people who have the same problem, and you can freely discuss, a lot of things are learned through the support group. A lot of coping mechanisms are learned with, because also you have the advantage that you're going to have a professional in that group. So it's also a way to meet professionals. Now, one thing that we do here in this part of the world is that we take most of our problems to churches, to mosques. I'm not against it, but you know what? There's a place for professionals in all this. How can you come and share your problem with somebody who does not understand what infertility is? Do you understand me? So it's important that you talk to professionals in 2019. One aspect especially that you might need to talk to professionals is sex. A lot of families faced with infertility also have sexual problems. And you know what? They rarely discuss it. I had the opportunity of talking to a couple, and they've not had sex in 2 years, and they're trying to conceive. Hey, come on, how's it going to happen? And they were not talking about it. Until it took some asking, pressing before. So, there are sex therapies even in Nigeria. Go to qualified people to help you. Look, there's something called erectile dysfunction in men. It's common with men above 40. Yes, we don't know what the figure is in Nigeria, but we know that in Europe, it's really up to about 40-50% of men above 40. We don't know what the figures are in Nigeria because Nigerians never talk about sex. Everybody wants to be looked at like a stud. Well, I don't care whether you're a stud or not. That's not the important thing. The important thing is that if you have a problem with this, it can be solved. And there are people who can help you to solve it. So if sex is an issue in your marriage, please send message to people who can help you, even if you don't want to confront them face on. Speak on the phone. Let us get rid of some of these problems, especially those problems that we can solve. One other thing that you need to do is that you need to start, if you're TTC this year, you need to start using multivitamins, especially things like folic acid. Folic acid is not a prescription drug, it's an over-the-counter drug. So you can use it. You don't need anybody's prescription to use folic acid. So that can be done. But better still, especially for people who have been trying and they've not succeeded, you can go for preconception care. Tests can be done, which might also show some other things, especially if also you have some other diseases that, for example, diabetes. We might want to see how your control of the diabetes is. For people who have been having miscarriages, this is a very important part because now there's genetic screening. We can find out why you are having miscarriages. We can see profile solution for some of these things. Some people are carrying all of us are carrying genetic mutations, but some couples have the same mutation. And it's a matter of time, they're going to bring forth children who are probably carrying, depends on whether it's dominant or recessive. Each time they have a baby, there's either a 25% or a 50% chance that the baby will carry that problem. But this we can diagnose now. This we can take care of. And so for some of you, we might be able to profile solution to this. So I think one of the things that we need to do this year is to talk more. Talk to professionals. Let them be able to counsel you. Everything is not about money. Sometimes you don't even need to pay for some of this care. You can come in and talk to most fertility clinics. Inquiry is free. You can talk to them and you can start from here so that you know what exactly you are up against and we can know how to solve it. So please, let us talk more. Let us ask questions. The doctors don't know it all. I mean, after all, it's your body. You must be comfortable to ask your doctors questions. If your doctor is feeling uncomfortable because you are trying to understand what the problem is, vote with your legs. You need to be able to get the best from doctors. You know, a few weeks ago we spoke about how to choose the fertility clinic that is right for you. I think you need to listen to that again. You need to, when you are facing infertility, you need to choose the proper clinic. The days and time where it's because it's my husband's friend, it's my family doctor, those days are gone. You need to make up your mind what you want to do for yourself. And you know what I've seen is that the difference between patients here and patients in developed countries is that patients here don't read. The internet has blessed us with almost everything. Typically, when a patient is going to consult abroad, he will have downloaded some things. Some things he will have done his own homework. There are some questions that were scribbled down that he wants to talk to the doctor about. But here, we just come, you know, we still have that impression that it's malaria. You know, when it's malaria, the doctor just tells you, no, it's chloroquine and this. This is not that era anymore. We need to be able to ask doctors questions. One last one that might shock some other people is that in 2019, studies are beginning to show that your dental care might affect your fertility. So you need to take care of your teeth. Brush and floss every day. And this has been shown that the dental hygiene of men and women might affect the fertility, the time to pregnancy, and also the quality of the sperm count, and also the quality of their eggs. So, in men, gum diseases and tooth decay have been linked to poor sperm and sperm health. This was an Israeli study that was published sometime last year. So, we are beginning to see that. You see, we keep saying that for you to get pregnant, you need to be healthy. So, the health is not only now, it's all total. It's all encompassing, including your dental health. So, for this year, like we said, our aim is that if you are TTC, before December 2019, you should be carrying your babies. But for you to do that also, you need to do a few things to help the professionals who are going to look after you. So I wish you the very best of luck in 2019, and your expectations will not be cut short. I think it's a good start to the year, and I'll see more of you this year. Thank you very much for being part of this program today. And please do not forget, if you have not collected your gift, please do so for the top fans. That's what I mean. Please do so. And this year, I promise that we're going to we try to be more interesting. And if you have anything you want us to talk about, if you have any idea you want us to apply to this program, please feel free to share with us. That's why we're here. And God bless you. See you